It was only a matter of time.
This evening, a patient suspected to have coronavirus has tested positive.
As soon as the health minister made the announcement on March 11, months of pre-planning kicked in. Schools closed the next day, the start of what would become almost a year-long homeschooling program.
Our goal is that our children shouldn't be alienated from their lessons and miss out on their education.
By the end of March, an uneasy silence had settled over the country. Public meeting places, bars, beauty salons, barbers and gyms all closed. Cafes and restaurants could operate on a takeaway basis only, and people aged over 65 were confined to their homes. On March 18, the President announced a $15 billion economic package designed to help struggling businesses and people in need.
The coronavirus outbreak has brought daily life to a standstill, and serious economic consequences will also arise due to voluntary and compulsory quarantine measures.
And they only got tougher in April. People under 20 were prohibited from going outside. Weekend lock-ins were enforced for all ages, and Turkish Airlines suspended all domestic flights. The usually bustling city streets may have appeared quiet, but some industries were working overtime. Turkey scaled up the domestic production of medical equipment, including masks, gloves and ventilators. Huge consignments were sent overseas. President Recep Tayyip Erdogan says Turkey provided medical aid to more than 150 countries. Turkey's contact tracers were also kept busy. Specialist medical teams tracked new infections to see who else a patient may have come into contact with. At their peak, 6,000 teams were following 200 cases per day.
The more cases and the more contacts we reach, the more people we isolate, the cleaner the community actually.
Dedicated COVID-19 hospitals were rapidly built across the country. The government credits the use of experimental medication and a greater number of intensive care beds for keeping Turkey's COVID-19 death rate amongst the lowest in the world.
This is a huge difference from other countries. This is what makes this difference. The first reaction is very rapid.
By the middle of May, the government declared Turkey was back open for business. Flights resumed, shopping malls, cafes and restaurants reopened, and international tourists gave the economy a much-needed shot in the arm.
We are creating the new normals of a new life, which will be different from the normals before. It is a new way of life, free but cautious.
But as winter approached, those cautious freedoms dried up. Face masks remained compulsory, but in December, bars were forced to close again. Cafes and restaurants reverted back to takeaways only, and weekend lock-ins were reinstated. Turkey is now largely relying on a Chinese vaccine for early immunisations. It has 16 locally developed candidates in the works. The first is expected to be rolled out in April next year. So, although the grey clouds of COVID-19 still linger, there's a glimmer of hope on the horizon. Melinda Nusafora, TRT World.